Hey everyone, in this week's Thrive in 5, I wanted to talk to you about rib pain that can be causing shortness of breath, pain when you inhale or exhale, and sometimes other challenges in people's health that can be easily resolved with some chiropractic adjustments. We know that the vertebrae in the middle part of your back and the thoracic spine, which starts right about here and goes down to roughly the end of your rib cage, they have attachments for your ribs. So if the mid joints in the back are not moving the way they need to be, if they're restricted in motion, if they're subluxated is the term we use as chiropractors, what can happen is where the ribs attach can also be slightly shifted. And that can cause all kinds of symptoms. The biggest one that we'll see with people is they'll just feel like when they take a big breath, they feel like they get a sharp shooting pain in their chest. Sometimes people even get concerned that they might be having chest pain, or maybe even something more severe like a heart attack. But really, if we can rule out all the other symptoms that are associated with that more serious, heart attack, we can narrow it down to dysfunction in the rib cage. And when we adjust them, we gently adjust the ribs. You'd be tremendously surprised at how effective and the amount of relief that people get when we take care of it. So it is something simple, something that we see as chiropractors almost every day in our practice. And just like gentle adjustments to your neck, to your mid-back, to your hips, to your pelvic joints, adjustments to your rib cage are safe, they're effective, and they can alleviate a number of dysfunctions in your middle back. Sometimes what will happen, when your ribs get out of alignment, it can be caused by coughing for a great period of time. This time of year in my practice, every week there's been a number of people who've had coughs and congestion. So when you're coughing quite a bit, sometimes it'll cause the ribs to slightly get strained or shift. Obviously, people who train physically hard, if they do a lot of rowing, if they do a lot of overhead press, sometimes a lot of pulling with weights, different physical activities and sports hobbies can also trigger the ribs to get slightly out of alignment. But again, as I said, really, really easy for us to fix as chiropractors. So if you are dealing with any kind of challenges with how you're breathing, any shortness of breath, any burning pain that's going around your rib cage or down your arms even, it's worth talking to your chiropractor and seeing if there is a connection. Your chiropractor will obviously also be able to tell you if there's something else going on that might need a referral, if there is something more serious going on that needs to get to the emergency room, or if this is something that can easily be resolved with a chiropractic adjustment. I hope this helps. We'll see you next week.